SoCal hospitals. The number of ICU beds across the region are near non-existent. Riverside County is already at 0% ICU capacity, and other counties aren't far behind. Dr. Dong Chang from Harbor UCLA Medical Center is deeply concerned.
If we're going to be quite frank about it, we are exceeding ICU capacity right now.
Health officials say LA County hospitalizations are breaking records while hospitals face staffing shortages, overwhelming nurses like Carrie Cavazos.
Our nurses are infected, our patients are infected, the surge is real.
Cavazos is a registered nurse at Riverside Community Hospital. Her hospital, along with West Hills Hospital and Medical Center and Los Robles Regional Medical Center, are striking on Christmas Eve. 2,500 nurses plan to walk out for 10 days.
I don't think a strike is the best choice, but sometimes it's the only choice.
With hospital staff getting sick and nurse shortages, hospitals are already stretched thin, especially for a surge. But Cavazos says they're fighting for safety.
If you just put yourself in a situation so very hard to walk in the door in the fear of, if my patient's going to make it today.
Governor Newsom issued an executive order to change the nurse-to-patient ratios for care, meaning nurses are now taking on more patients at a time amid the shortage.
So just stretching resources and, again, empathy and respect to those human beings.
Cavazos fears the new ratios put staff and the community at risk during the surge.
If we take more patients in this pandemic, it makes us unsafe. And as a nurse, that is our highest and utmost priority, is the safety of our staff and our patients and our community.
And Orange County is in trouble too. Their healthcare agency there plans to deploy mobile field hospitals, and they're going to start building those hospitals next week. Reporting live this evening, I'm Coco McAvoy, Fox 11 News.
So what exactly would it take so that there isn't a strike next week?
So what they're saying is they've been at the bargaining table since July 7th, and they're saying that they want more PPE. They're saying right now they're having trouble getting masks, and they say obviously that's a big deal. They really need masks in order to care for the patients. And they're saying it's really not about money at this point, that it's about making sure that they have PPE and safeguards in place so that they do not contract COVID-19, or at least are less likely of contracting the virus.
Yeah, you would hope 9 months into this we would have PPE for our nurses. Coco McAvoy, thank you for your report.